Hi everybody, this is Ma Barker coming at you again from the greater Seattle area. It is Thursday evening, November 3rd, 2016, and I'm here just to update you on where I'm at. I have surgery scheduled, VSG surgery scheduled for Tuesday, so 5 days from now. I just finished my final appointment yesterday, and I got home tonight and I'm really tired, but I wanted to post a video and talk about some things that I've been finding that I've not seen talked about on YouTube yet. It really kind of surprised me. But before I do that, I want to answer some questions that I see a lot of posted on some bariatric sites I've been looking at. And one of the questions that I see repeatedly are people asking questions about the pre-op diet. Has anybody ever cheated on the pre-op diet is the question. What happens if you cheat on the pre-op diet? Well, I am very happy to say that my pre-op diet is not a liquid diet. I can have food up until Sunday, and then Monday morning I start clear liquids, and surgery is Tuesday. So the day before surgery, they require nothing but clear liquids. But up until the day before surgery, so up until 2 days out, I can continue to eat. But they do want me to have, my pre-op diet consists of 100 grams minimum of protein a day and a maximum of 20 carbs a day. Have I cheated on that? Absolutely. Limiting my carbs to 20 carbs a day, 20 grams of carbs a day, is very difficult sometimes. I get used to it, but then I found not having any carbs, I really get tired. I work between 55 and 60 hours a week, Monday through Friday. And my round trip commute time is normally a minimum of 2.5 hours. So I'm up and going and running a lot. And without any carbs, I get kind of sluggish, especially towards the end of my shift. So I go real strong for about 4 or 5 days on the pre-op diet, and then I'll break down and I'll have some carbs, whether it's a bowl of pineapple or, I don't want any bad comments about this, or I'll have a cheeseburger from McDonald's, or I'll have a taco salad from Taco Bell, and then I'm good. That works for me. Now, when I went in for my appointment yesterday and got all the checkup things, you always get your weight taken, I'm down to 301. I started at 328. I'm down to 301. And at my last appointment, I was at 308. So I've dropped 7.5 pounds on the pre-op diet, which is good. And that's with eating a cheeseburger every 5 or 6 days or something like that, because I needed it. So I'm not saying you should do it. I'm just saying follow your doctor's instructions. But I'm very pleased to say my doctor doesn't require that restricted of a diet. Now, when I met with a surgical PA yesterday, he gave me a script, and I haven't heard anybody mention this before. It's for a new drug. It's called AMIND, E-M-E-N-D. A lot of insurances don't cover it, and he said it's not mandatory that I give it because my insurance doesn't cover it. But if I wanted to get it, he said that would be helpful, but if not, that would be fine too. And what it is you take it you take it with you to the hospital on the day you have surgery, and then the nurse will instruct you when to take it. And what it's supposed to do is block the nausea from occurring. A lot of times with opiates and narcotics, it makes people nauseous. It does me. I can't stand narcotics. And it makes me real nauseous. So they give you Zofran, or I prefer Phenergan. But he wants me to take this AMIND, and it's it stops the nausea from occurring. And so I asked him, I said, well, what's the difference in this drug and Phenergan? He said, well, with Phenergan, you take Phenergan after you feel nauseous. If you start feeling nauseous, then you take the Phenergan, and the nausea, it should help the nauseousness to go away. But with this AMIND drug, it blocks the nausea from even happening. So it doesn't end the nausea, it blocks it from occurring in the first place. So I thought that was kind of neat. Now, I did call my pharmacy to see how much the script costs, and I can see why the doctor doesn't make it mandatory. You know, I've paid $100 for a script before in the past for, whatever I was getting, I don't recall, but I know I've paid $100, $110 for scripts before that the portion my insurance wouldn't cover. And I was always okay with that. And you get a 30-day supply. Well, this script at my pharmacy costs $143. Wow, $143. Now that's not a lot for a script for a month, but this $143 is a script for one pill. It's one pill, $143. But I'm going to do it. I'm just going to spend the money and do it because I want the full experience, and I want the best experience, and I want the best medical care. And the surgical PA highly recommended this. So I'll do that. I'm currently packing, making my list. My list of things I'm going to take to the hospital is much, much shorter than everybody else's. It's like 5 things. And I'll talk about that in another video, maybe on Sunday when I pack. But the one thing I want to talk about that I haven't seen anybody on any video, YouTube video, talk about is something called a bougie. It's spelled B-O-U-G-I-E. A bougie is a flexible tube used during the VSG surgery. And when I started researching it, I started seeing all kinds of people who knew about bougies on the bariatric sites, but never on a YouTube video. And what it is, it's a flexible tube that they put down your throat, and it goes into your stomach, and it gives the doctor, it's a measurement. It's a certain size, and it shows the doctor where to place the staples. And depending on how large or small the bougie is, it's a guide for the doctor to know how much of the stomach to cut away and where to put the staple gun. So the size bougie, it's measured in French. It's called French 4 bougie or French bougie 40, but the size is 40. Your doctor, if he uses it, might use a 36 or 42, but research has shown that the smaller the number, of course, the smaller the tube, and there's no significant difference in weight loss if you use a smaller tube to make a smaller stomach. However, there is a significant increase in leakage after surgery if you go to a smaller tube, and strictures. Well, what I found out at my appointment also yesterday is, I've watched a lot of videos, and a lot of you, after you get the surgery, you can't do anything until you take that drink. So they watch you on a scan, and you can see it on the TV, on the imaging, to see if not your band, but your staples are leaking, if there's a leak anywhere. And you say, the stuff doesn't taste very good. Sometimes it's hard to swallow and get down. It's kind of, you get anxious because you don't know how the new stomach and your sleeve's going to work. Well, my doctor doesn't do that, not routinely, because they said if a leakage is going to occur, it usually doesn't occur until about 6 weeks out or longer. And just right after surgery, there's a lot of inflammation and swelling from all the cutting and just from the surgical procedure. He doesn't do routine swallows after surgery. So That was great. So all these YouTube videos I've been watching from everybody about, doing the swallow and doing this and doing that, and man, you guys have it rough. I've got a great doctor. I've got a great facility, medical center in Seattle, and I couldn't be happier so far with the care. I'll be meeting with the anesthesiologist on Tuesday when I get to the hospital, and I'll talk to my surgeon again and tell them what I want and what I don't want as far as medication goes. A lot of people are treated for pain after surgery with Dilaudid. I don't like Dilaudid. It makes me incredibly sick, not just nauseous, it just makes me sick. So I've told the doctor no Dilaudid. Morphine, fentanyl works, but morphine works, but no Dilaudid. And he's okay with that. Actually, I told him Demerol, and he was okay with that too, but Demerol's a little harder to come by. And then I did some research on Demerol, and there's some negatives to Demerol as far as how it reacts in your body. I've always liked it, but I've researched it, and there's some things that can occur. So I've decided to go with the morphine instead for pain control. My surgery takes, like everybody else's, 1 day in the hospital, so I'll get operated. My surgery time is at 1:30, so on Tuesday. And what's really neat is I'll go into surgery. It'll take about an hour and a half probably. And then by the time I get out of surgery, get into recovery, get cognizant enough to go back, to go to my room and to sit up and have 2 teaspoons of broth and lay back exhausted in my bed, go for the walk. By the time I get back to my room, I'm going to be able to turn on the TV and find that we've got a new president elected for the next 4 years. And that's kind of exciting for me. So I'm having surgery on election day. So that's exciting. But all in all, everything's going real well. I was really, really scared and anxious about this surgery. Not about the surgery. I don't have any problem with the surgery. The cutting in and cutting out and cutting off and all that kind of stuff, the repairs of scar tissue and stuff the doctor's going to have to do, none of that's has bothered me. It's the anesthesia that has really had me concerned. I'm older now. If you're morbidly obese, you are in a high risk category when it comes to anesthesia. When you get a general anesthesia like propofol, they give you a paralytic because you just absolutely cannot move while you're in surgery, because the doctor, of course, is using very sharp instruments, and if you sneeze or you just have some kind of knee-jerk reaction, muscle spasm or something, it can be dangerous to you with the surgeon operating. So when you go in general anesthesia, they give you a paralytic as well. Well, when you have a paralytic, you're put on a ventilator, because if you have a paralytic, your lungs, your diaphragm's not going to work, push the air in and out of your lungs, so you're on a ventilator. And I have AFib, heart condition, so my risk category goes up and up and up. I'm not diabetic. I don't have high blood pressure. I don't have any other medical problems except for sleep apnea. Well, the condition for waking up from anesthesia and in recovery is apnea. And so I have to take my CPAP machine so that they can remove the ventilator and then put me on the CPAP machine when I go into recovery. But all in all, I'm not as anxious or frightened now that I've done more research. So for all y'all that are getting ready to go into VSG surgery, or you're thinking about it, do your research. Talk to your practitioners. Talk to your nurse practitioner. Talk to your physician. Talk to your surgeon. Talk to the PA surgical assistant. Talk to everybody you can, not just YouTube videos. YouTube videos have been fun. They've been entertaining. They've been informative. but they're not as informative as talking directly and asking your specific questions to all the medical personnel involved. There are a lot of people involved in this procedure, and when you go into the operating room, you're going to be surrounded by people, and people are going to be fritter and frattering around. There's all kinds of equipment. It's really kind of exciting and fun to watch, but this is not a one pony show. There's a lot of people involved in this process, so ask questions and don't go in there frightened or overly anxious. There's some concern, but one thing that's never mentioned in the YouTube videos is death. Anytime you go under a general anesthesia, that is a risk. However, for this particular surgery, the death rate for this particular surgery is less than 1/10 of 1% statistically. So when I researched that, that made me feel a lot better. So the risk of death from this surgery and any complications that might arise is very, very, very slim. Slim to none. So be excited, and good luck to you, and keep me posted. I'd love to hear how your surgery goes and what you found out. I hope you found this video informative. And until next time, this is Ma Barker saying, have a great night, enjoy life, and don't sweat the small stuff.